Giardiasis is a common intestinal infection caused by the protozoan parasite Giardia lamblia, also known as Giardia intestinalis or Giardia duodenalis. It affects humans and animals and is a frequent cause of waterborne gastrointestinal illness worldwide. Giardiasis is primarily transmitted through the ingestion of Giardia cysts. These hardy cysts are typically spread via the fecal-oral route. Common sources of infection include contaminated water, especially untreated drinking water or recreational water from lakes and swimming pools. Contaminated food, poor hygiene practices, and person-to-person contact, particularly in childcare settings or through sexual contact involving oral-anal exposure, are also important routes of transmission. Additionally, zoonotic spread from infected animals may occur, particularly in environments with inadequate sanitation. The symptoms of giardiasis usually appear 1 to 3 weeks after exposure. While some individuals remain asymptomatic, others may experience a variety of gastrointestinal symptoms. These include diarrhea, often greasy, foul-smelling, and non-bloody, abdominal cramps, flatulence, bloating, nausea, fatigue, and unintentional weight loss. In children, chronic infection can lead to failure to thrive. The hallmark of giardiasis is steatorrhea, which refers to fatty stools resulting from fat malabsorption. Diagnosis is confirmed by detecting the parasite or its components in the stool. Stool microscopy may reveal Giardia cysts or trophozoites. However, because the shedding of the parasite can be intermittent, multiple samples, typically 3, are recommended. Stool antigen tests, such as enzyme immunoassays and immunofluorescence assays, offer improved sensitivity. Polymerase chain reaction, or PCR, can also be used to detect Giardia DNA. In rare cases, duodenal aspirates or biopsies may be considered if stool tests are inconclusive. Treatment is indicated for all symptomatic patients and for certain asymptomatic carriers, particularly in high-risk environments. First-line therapy includes Metronidazole, given at 250 mg 3 times a day for 5 to 7 days. Tinidazole is an effective alternative, administered as a single 2-gram oral dose. Another option is Nitazoxanide, given at 500 mg twice daily for 3 days. For pregnant women, Paromomycin may be preferred due to its minimal systemic absorption. In cases of treatment failure or reinfection, a second course or a different agent may be required. Preventing giardiasis involves good hygiene and safe water practices. Always wash your hands thoroughly after using the toilet and before eating or preparing food. When in areas with questionable water sources, boil or filter drinking water before use. Avoid swallowing water when swimming in natural or recreational bodies of water. Wash fruits and vegetables with clean, safe water. Maintain proper sanitation, and avoid oral-anal sexual practices, especially with new or multiple partners. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.